All right, welcome back everyone to the deep dive. Really glad you sent us these sources. Today we're getting into something pretty fundamental in clinical practice. Foundational stuff, yeah, but your material really shows how packed with a critical detail it is.
That's right. We're looking closely at sterile wound dressing changes. Sounds simple, maybe. But, these sources really drive home that it's less a task, more a precision technique. Every single step impacts the patient.
Absolutely. And the core goal, according to this material, it's high stakes, ensuring patient safety, promoting healing. It's just a perfect example of how these sort of basic seeming procedures need real rigor.
Exactly right. It's not just what you're doing, it's how carefully you do it. Your sources break this down really well, covering, the prep work, the specific materials, the actual technique, those crucial precautions, and documentation too.
And even though it's about one specific skill, I think understanding this level of detail, this discipline, it gives us a really valuable shortcut, doesn't it, to appreciating quality healthcare more broadly.
Yeah.
Okay, let's get into it. Your source starts with preparation. What makes this more than just, grabbing some supplies?
Well, preparation, as your source points out, is often where things go right or wrong from the start. It's not just about the stuff. It's really a whole assessment. Does the source mention checking pain levels before you even begin? Because that can totally change things.
Right. Patient cooperation.
Exactly. And setting up the environment, too. Minimizing distractions, getting the patient positioned correctly. And, of course, hand hygiene. It's not just step one. It's the foundation for the whole sterile process.
Right, getting ahead of potential problems. So what specific materials does your source list to keep that sterile field, sterile? It's definitely more than just a bandage, isn't it?
Oh, much more. You need sterile gloves, obviously. Then the right kind of sterile dressing for that specific wound could be gauze, hydrocolloid, foam, whatever the source specifies. You need a sterile cleaning solution, usually saline, and applicators. Sterile instruments, maybe. And importantly, a waste bin right there within reach.
Within reach, okay.
Yeah, and the source probably highlights having everything opened and ready before the sterile gloves go on. Big point. Because once they're on, that's it. You can't touch anything non-sterile. No rummaging around for something you forgot.
Okay, that makes sense. The workflow is critical. So patient prepped, environment set, sterile stuff laid out meticulously. Now we get to the really challenging bit, I imagine. The technique itself, keeping everything sterile through the whole process.
This is absolutely the core of it. Your source likely spends a good chunk of time here. It starts with taking off the old dressing carefully without, contaminating the wound or yourself. Then you assess the wound again.
Looking for what specifically?
Size, drainage type, and amount, tissue appearance, any signs of infection. Then the cleaning. Using sterile technique, moving from the cleanest part outwards usually, so you don't drag microbes into the wound.
And I bet the source stresses drying the skin around the wound before the new dressing goes on.
Absolutely. Yeah, moisture around the edges. Bad news, weakens the adhesive potential bacterial growth, then applying the new sterile dressing. And the trick, like your source probably details, is only touching the very outside edges of the package or the dressing itself. The part touching the wound stays pristine.
That whole sequence sounds like it needs intense focus.
It does. It's a sort of controlled performance. Constant vigilance.
Vigilance. Okay, so what are the absolute, non-negotiable precautions your source really emphasizes? The deal breakers for sterility.
Oh, the source probably very clear here. If sterile touches non-sterile, it's contaminated. Full stop. If your sterile glove bumps the bed rail, your gown sleeve, even the patient's clean sheets doesn't matter. That glove is done.
Done.
Meaning contaminated, no longer sterile. Same if the sterile field goes out of your line of sight or if you turn your back on it. Too much risk. Any breach, as your source likely says, means you stop. Discard the compromised items, get new sterile stuff, and start that part over. No shortcuts. The risk is infection.
Wow, starting over. Frustrating, I bet, but you have to do it for safety. Okay, last piece. Documentation. Why is that so critical, according to your source?
Right, documentation, it's not just paperwork, it's vital communication and legal cover, frankly. Your source probably emphasizes recording the date, time, exactly what the wound looks like, size, color, smell, drainage details, what you cleaned it with, what dressing you applied, type and size, and importantly, how the patient handled it. Pain level included. This creates that essential record, tracks progress, lets other clinicians know exactly what's going on.
Okay, so let's tie this together. We've walked through the key steps. Meticulous prep, careful materials handling, the actual technique maintaining sterility, sticking to precautions no matter what, and then documenting everything.
And it loops right back to that fundamental why from your source material. Every single one of those steps, done right, builds this layered defense, protects against infection, creates the best possible environment for healing. It's a direct connection. Procedural detail impacts patient outcome.
And for you listening, really getting this level of detail, understanding the reasons behind the steps, the common mistakes, the things you absolutely cannot compromise on, it's highlighted in the source. It gives you a much richer understanding of clinical care, right? More than just a checklist. It's about efficiently grasping those core insights.
Which, makes you think, if a procedure that seems this foundational, this relatively straightforward on the surface, demands such precision and awareness of hidden risks, what does that tell us about the complexity buried in other, maybe more complex healthcare protocols? How do these tiny details add up to affect the bigger picture of recovery and, well, system safety? Something to think about.